Whoa. Who is that? Farouk? What's going on? Mustafa? What's happening? What's happening? JSK Sciences. What's going on? Dahlia, what's happening? I'm just letting Instagram story know right now. Letting an Instagram story know about our live stream. Shakib. What's up, Shakib? Werner, what's happening? What's happening, Werner? Werner, what are you up to? Anila, what's going on? What's happening? All right, I gotta let this Instagram know. All right. Rizwan is straight into the questions. Guys, why don't you give the live stream a like as you dip in? Why don't you give the live stream a like? Rizwan. Don't like the live stream. It's fine. Don't give it a like. No problem. No reason to like the live stream, right? Ask free questions. We'll just have like a free sesh, right? No need to like it though. Rizwan, do the NBMEs repeat? They do repeat. Okay, so I've talked about this a lot. How the questions from the offline forms repeat on the online forms, and they repeat on your real deal, and you might not even realize it because questions that don't give you a problem, you're not really going to remember. And even the comp CBSE forms a lot of you get for school, those questions repeat as well. Okay, I have a way that I know that they repeat. And also there's anecdotes of people's real exams with those questions showing up on the NBME exams, offline and online. So they just like reuse the same pool of, let's arbitrarily say, like 10,000 questions or something that they have. Those questions repeat. Okay. And I was saying that the anatomy questions on my real step one in December of 2012, those anatomy questions show up on offline NBME 24. I think it's a repeat block because the anatomy questions I'm thinking of were around 10 questions apart in the fifth block, and they show up around the same distance apart on NBME 24. I think the block repeats, and then also there was a dude way back where he and I had the same like questions, the same points in the exam. I said, was your third to last question of the entire exam this x-ray with an arrow pointing to this? And he's like, yes. So I think we had the same exact exam as well. Shada, what's going on? Yassine, what's going on? Miriam, what's going on? Dahlia, what's going on? Ahmed, Zaid, Goar. How should one have breaks during step one? First of all, okay, there's three main points, okay? Three main points. The first is, if possible, do the first two blocks back to back with no break. Take 60 seconds sitting at your desk without leaving the testing room. If there's no crisis during the first block, just take 60 seconds, you're sitting, you're just like, all right, and then you just go straight into the second block. Good momentum. That's the first point. The second point is, don't take an extended lunch break. Don't have like a 20-minute lunch break. Don't do that. The third point is, just after the first two blocks back to back, no break, just do 5 minutes, 5 minutes, 5 minutes, 5 minutes all the way through. That's how you should go through the USMLE. Okay. And I'll have a little bit of caffeine after each block. Let's see, the chat moved. Nargis, what's happening? Abdul Malik, what's happening? Ahmad Nasser, what's happening? Mustafa Elamam, which Anki cards should I do? Well, we've got Mehlmanmedical, right? Mustafa, a different Mustafa. Just finished with work, Slave Max. Ahmad, what's going on? Hassan, Tahir, what's going on? Yassine, we have a lot of questions for you, bro. Well, you got the number one with the crown next to you today. I still don't know what that means. If someone were like $10,000, what is the like the number one, number two, number three crowns next to the names mean? I still don't know. Like I think like some of you guys have tried to explain it. I still don't know what it means. Because there was like someone who was like a number two crown, and I've never seen them before in my entire life. So it's like clearly it's not like how much you comment, you know. And I've never seen them before, like not even commenting on like my YouTube clips. So K Vital, 3 years to graduate. Should I start hard work for USMLE? 3 years to graduate. What does that mean? Are you in second year right now? K Vital, what does that mean? Ahmad, thank you for your help to provide such a nice platform. Rizwan, David Ames. What's going on, David Ames? Dahlia, what is the most repetitive system in step one? I've said endocrine. If I had to choose a singular system, I would say endocrine. Okay. But in terms of the number of points, pathophys. Okay. I've talked a lot about this stuff. But endocrine, you can't fuck up two things. You can't fuck up hormones, can't fuck up anything endocrine. SIADH, DI, aldosterone high versus low, the repro hormones, PTH, vitamin D, thyroid, acid base, bicarb, CO2. You can't fuck up any of that on USMLE. And then pathophys, as I've said, is take any disease and be able to answer like 6 basic questions about it: inheritance pattern, mechanism, how it's diagnosed, right? Just be able to answer like 6 basic questions about any disease. So that's pathophys. And the hormones, endocrine, that's what you need to pass. So when you ask like the most repetitive system, it's like, you know, you might have a step one where it's like, you know, you feel like there's a lot of cardio versus a lot of biochem. It's hit or miss, and it differs for every student. I've heard anecdotes across the spectrum. Werner, blasting Mehlman QBank, enjoying your colors, having highlighting issues though. I'm sure it's not just me. We were doing an update on the highlight. We actually just like deployed an update like an hour ago, and I was worried that like it was going to annoy some people. Yeah, but we just made an update to the highlight like an hour ago. Mustafa, how can I balance between studying and work this summer, 5 days a week? By just studying when you're out of work, or decreasing the amount that you're actually at your job, if you can do that. They conflict, you know. So you just have to be hyper efficient when you're out of work. So it's work. You have to make work, or you have to make room for the gym, and then you have to study, and you would have to cut out socializing basically, if you're willing to do that. If you're not willing to do that, then you just have to have mediocre study. So you got to cut out socializing. Your ability to succeed is based on how much socializing you can cut out. A lot of you don't want to cut out the socializing. Socializing doesn't mean you're like going to that club. That's not what it means. Socializing means like, you know, it can even just mean like going on dates. Like it just, you need to cut out socializing if you want to succeed and be like, you know, high percentile. A lot of people don't want to do that. Well, guess what? A lot of people are in high percentile. Pop teens. If you're studying full time during the day for step 2, 8 hours, how would you divide it throughout the day with Mehlman QBank PDF? Well, you're going to do 40 to 80 questions a day, untimed tutor random. And then you'll do the Anki/PDF in the evening. So if you're saying 8 hours, you could do 40 questions, 50 questions, 40 to 60 questions in 4 hours, and then you could do 4 hours Anki. And we're talking like unprocrastinated hours. So it's like that's over like a total of like 10 hours, assuming that like, let's say you finish QBank and then maybe you have lunch, you watch some YouTube stuff that's not med related, escapism, and then you're like, all right. And then you're taking a break between every hour of Anki because you're spacing out. Like, let's just say it takes you 10 hours to do 8 hours of study. That's how you do it though. And then you'd have like the gym either after QBank before Anki, or you'd have it after Anki at the end of the day? Ibrahim, how long should a QBank take me to finish for step 1? 4 to 6 weeks. Our 2700 QBank, it's like over 2700 questions. Take you, I think it's like approaching 2750 now. We don't want to make it too large, but we're adding important stuff. But month and a half, within a month and a half. Shakib, as an undergraduate student, how can I manage my medical professional exams, USMLE preparation? Should I bother about research? Research is not important for the match. Okay, obviously, if you want to do like radiology at Yale, fine, have your research, but like it's overblown and a lot of people embellish. No one cares about your 36 bullshit papers. No one cares. People know it's embellished, or they had an easy advisor. So what they care about is the 2CK score. But I'm not just saying this like somewhat facetiously, like anecdotally. Like I've had students in the past with like obnoxious amount of research and decent USMLE scores and like not get the placement they've wanted. So that taught me that it's actually scores that matter. Because it's like, how can you take somebody who's got like 40 research papers in dermatology and then has like a USMLE step 2 CK score of 259 and then they like don't match into derm? You know what I'm saying? So it just shows you like, well, there's a lot of people in the 260s, a lot of people in the 270s who want derm because it's cush lifestyle. You get your cash, right? No one's actually interested in skin. It's just you want cash and you want a cush lifestyle. That's the only reason anyone would do derm. No other reason. Okay? If raking leaves paid $900K a year, you guys would be lining up to rake leaves. You'd be like, yeah, I'll rake leaves 8 hours a day. That's great. You get $275 to rake leaves. The Beautiful Medicine asks, what do you think about Pathelma for step 1 and 2? Does it, I mean, there's a variety of resources. It's more just that you need to consolidate. Okay, so if we talk about, rather than you doing 12 different resources, if you consolidate and say which resources are going to give me the greatest augmentation and score in the shortest amount of time, I've articulated that it's a balance between when I push Mehlman resources, that pisses some of you guys off because you're like, well, you're a fucking asshole for pushing your own paid products. So there's that 50%. And then there's the 50% element of I have a responsibility to help you augment your score as much as possible. And it happens to be the truth that our resources are the best. So how do you balance that, right? So if you do Mehlman QBank and you do Mehlman Anki with the PDFs and the YouTube, you'll get the greatest score augmentation in the shortest amount of time. And then you can counterbalance that by saying, Mike, you're a fucking asshole for pushing your products. Okay, I mean, but as I said, it's a responsibility to tell you how to get the greatest score increase. So what do you want me to do? Werner, if you had to summarize the order of importance for the topic for step 1 and step 2. I already said for step 1, endocrine and pathophys. And just so endocrine PDF, pathology PDF, ARAS PDFs. Step 2, internal medicine surgery. Internal medicine is literally all of medical school, all 4 years. So it's like it's every topic. Nargis, any plan to go over NBME 32? What do you mean go over NBME 32? You guys need to do that for your assessments. Like, why would I spoil it by like doing it on the YouTube? And in addition, there's like there's like copyright aspects. Anyone who would talk about like who would actually do like NBME questions, free 120 questions, stuff like that on their YouTube, they're not a serious channel because that stuff's like copyrighted and that's not a good idea. Like I would never, like all the questions I do on my YouTube, I write myself. So like, yeah, I wouldn't cover that for copywriting reasons, but also because you guys need that for assessment. So it doesn't make sense that I would like do that NBME for you guys. The same way I didn't do 31 for you guys. Like you'll use that stuff as assessments. Abir Khan, your tryout is October to December. You started UWorld September 1st, around 60 questions a day. Will you do it in time or do you have to extend? You should be fine. September, October, QBank, and then you'll just do NBMEs after that. Abi or Khan. You started UWorld on September 1st. My question is, why did you choose that? Did you not know about Mehlman QBank, or were you like oppositional? Were you obstreperous? Like what was your thought matrix that went into that decision? Let's see. Because you're not like a rando off the street. You're in a Mehlman live stream. You know what I'm saying? I'm not like poaching you off the fucking street. It's like you're in a Mehlman live stream, so you clearly know Mehlman's content, right? Let me see. Let me scroll down. Chat moved. Dahlia. I already answered. Oh, no. How to stay focused for 8 hours in the exam and what snacks should we eat to increase energy? You'll be very focused during the USMLE. You're not going to have a problem because it's something about when you're actually in the real medical licensing exam and your ass is on the line, you'll make it happen. Okay, so as I've articulated, you'll do the first 2 blocks back to back with no break. Take 60 seconds sitting at your desk without leaving the testing room. And then after the third and fourth blocks, or after the second and third blocks, you'll have a few sips of caffeine, maybe half a protein bar. After the fourth and fifth blocks, you'll have half a PBJ sandwich, a few more sips of caffeine. After the sixth block, no more calories, just caffeine. That's what I would do. That's what I did, actually. That's what I did. And no extended lunch break, right? Don't do 20-minute lunch break. Just 5 minutes, 5 minutes, 5 minutes, 5 minutes all the way through. Fastest day of your entire life, USMLE will be. Fastest day of your life. Shakib, hey, I'm stuck at 70% on my 4 NBMEs. They're not improving whatsoever. Exam's very near. What should I do? It's source of tension. 70% for step 1 is great because we said 68 plus on 3 plus NBMEs, so you need to have safety / a buffer. 65 is pass. 70% on step 2 would be maybe a 238. NBME, or what am I fucking saying? Username NB. Can you lay out study schedule for step 1 for 9 to 12 weeks? Are you asking for like a personalized Zoom seminar? Is that what you're asking for? Like you want a personal schedule? Is that what you're asking? Lay out a study schedule. Well, those custom schedules are what I chat over Zoom about, which I don't have time anyway. But let's just give me, if I were to give you some umbrella schedule points, you're going to do QBank first, right? So 40, 80 questions a day, as I've said, untimed tutor random. So 48 blocks of 10. And then in the evenings, as your phase 2, that's when you're going to do Mehlmanmedical, minimum 4 hours. And if you're poor, if you're living with cockroaches and you're poor, you can just do Mehlman PDFs, which are 11 out of 10. Okay, they're 11 out of 10. Do the PDFs. Do the Mehlman YouTube. It's free QBank, Mehlman YouTube, video QBank. So you'll do the written QBank that we have, and you'll do the video QBank as well. It's 2 QBanks. And you do Mehlmanmedical, and if you're poor and you're a complainer and you're a whiner and you're resentful, then just do like the free PDFs. No problem. And after you finish QBank, then you'll go on to the NBME exams. Assam Tahir, 42 days until your step 2. Okay. Could just said you have like 7 weeks or so, or 6 weeks. You've done NBME 10, UWSA 1 pass of CMS forms. I'm doing your IM PDF. Would you recommend a max my score aiming for 260 plus? Why did you do NBME 10 already? You're going to end on 9 through 15. Before that, you'll do free 120. Before that, you'll do 6 through 8. And you'll want to second pass the CMS forms as well. That's what I would do. An alternative to that is you blast through Mehlman QBank. So if you have 42 days, you could, let's say, because you've already done the CMS forms, you could blast through. You could do like 25 days, 100 questions a day, Mehlman QBank. And then you could do 6 through 8, free 120, 9 through 15, Hassan Tahir. And you'll be like, fuck, this is like really reinforcing NBME stuff. Shit. Yassine, Docs, Andrea. What's going on, Andrea? Loana, Shakespeare. How to differentiate DIC from TTP, completely unrelated. They both have schistocytes, right? They both have schistocytosis. DIC, TTP. HUS, HELP syndrome, mechanical hemolysis. Those are your schistocyte conditions. DIC, obviously increased bleeding time, increased PT, increased PTT, decreased fibrinogen, increased plasmin activity, increased D-dimer. Okay, sepsis, trauma, amniotic fluid embolism, treatment of AML, some causes, TTP. So obviously renal issues, and you're gonna have fever, neurologic signs, schistocytes, thrombocytopenia, the whole ADAM TS13, antibodies against or mutations in, right? Matrix metalloproteinase, a failure to break down von Willebrand factor multimers. Okay, so you can do plasmapheresis, 2CK answer for TTP. DIC, you can do fresh trails in plasma, cryo precipitated fibrinogen is hyper low. Sylvester, do you think I should get us clinical experience? Get us clinical experience. Do you think I should get US clinical experience in the summer past step one? Can I pass step one during the school year? Would I need proper time for dedicated? I mean, the fact that it's pass fail, you're going to do both. It's not one or the other. Like you would, it's overrated, like clinical experience. It's more just you need a letter. So just do what you need to do to get letters. Okay. And you're going to figure out how to balance your step one prep. You're studying for step one throughout the school year. Absolutely. Whether you're going to do step one during the school year, you could basically create a dedicated of like 2 weeks only, for example. And then you could have the rest of the summer to do some like a 1 month observership somewhere, you know, but your important letters are going to come from away rotation somewhere. Right? Like if you want to do pediatrics, you would get a pediatrics rotate. You'd say, I want to go to Boston to do pediatrics, and you're going to set up an away rotation, try to do that. That's what you're going to do. And you're going to get a letter from that place, and then you're going to apply there. That's the importance of the letter, of the clinical experience. Not really what you do after first year. Yassine, how many blocks should I do per day? I already said 4 to 8 blocks of 10. Docs, you got 66% your first NBME. Should you book an exam for next month? Yeah. So you just got to get 68 plus on the NBMEs and you're fine. Ahmad, how long does it take to prep for step one? 3 months. NB, is it good practice to do step 2 CK questions for step 1 prep? The answer is no. Dahlia, good, detailed. Why are you so arrogant? Serious question. Am I? Or is it just confidence? I think people mistake like confidence and arrogance. I think I have a good check on my hubris. Right? I'm very sure of myself. And I think that maybe to some people that like is irritating. But you know, you don't have to subscribe to my stuff. I have haters. I'm used to hate, trust me. I'm used to hate. Yassine, what about the questions which are really tough? Should I understand each word? I mean, you don't want to dither and sit on a question longer than you have to. I don't think you have to understand each word. I think you just need to understand like a key point of what a question is getting at and then just answer it. In fact, a lot of the questions that are in, some of the questions that are in Mehlman QBank, I would not try to understand each word because I've written some really, really, really long questions on purpose, because the point is to help you practice just answering the question quickly and efficiently rather than getting pulled into a lot of the detail. And if some of you doing Mehlman QBank, those really, really, really long questions, especially those farm ones, that's me. That's me. QUIQUE, Magia. Greetings, doctor. What do you think about using ChatGPT as a resource for studying? That's fine. I think that's pretty like normal to do. It's like saying, what do you think about using a calculator to do math homework? So I think if you're not using like Google AI, Grok, someone was asking about DeepSeek, if you're not using one of these platforms to help you, then, you're not really with the times. So, but it's wrong sometimes. You have to just be aware of that. It's pretty good, but it can be wrong. Because I've asked it some things and it's like wrong occasionally. Think of it as like a very, very, very like confident person that's like wrong sometimes. It was like telling me convincingly that blastomycosis has narrow-based budding. I was like, no, it doesn't. It has broad-based budding. And I was like, no, it has it has broad-based budding. It was like, no, it has narrow-based budding. I was like, no, it's broad-based budding. And I was like, that's very fucked up, but it was like very, very confident. And it like reinforced its answer. And then it was like still wrong. So, but I mean, it's still better than most humans, right? That's the thing. Victor, any advice on doing NBME 16 through 25 in 2025? I'm doing step 1 in November. I've never prescribed earlier than 20. So if you want to do 16 to 19, you can do that. Just do 20. You can just do 20 through 25, free 120, and then do 26 through 32. Like you don't have to do 16 to 19. You can if you want. It's not a big deal. It's just you don't have to. Saifabu, do you recommend 2 passes on QBank? You're trying to reach high NBME scores, be more confident in the real deal. You don't have to do 2 passes of QBank. Like even if you're doing Mehlman QBank, and I'm flattered, you don't have to do 2 passes. If you do 1 effective pass and then the NBMEs. If your NBME scores aren't where you want them to be, yes, you can go back to your incorrects. You could theoretically do a second pass, but if the question is, do you prescribe that as like a default setting for study, the answer is no. Like that's never been like a default setting. Like we offer that, like clearly, like, if you get a 6-month plan, like we offer the one-time reset, like that's just a standard thing to have. But like, I don't think you have to do a second pass of QBank. Just do the NBMEs after you finish the singular pass. Ahmed Salama, how do you deal with the problem of random mode in QBanks? I find it very difficult that every Q is from a whole different chapter. My brain is so puzzled. That's okay, and it's understandable. It's like a puzzle that you use the word puzzle as well. It's like a very pixelated puzzle that will come together. But I think it's important for macro retention to do random mode from QBank. So you have a question on Duchenne, then placenta previa, then cystic fibrosis. So you just have mixed questions. I think biostats, I think all that's important for macro retention. But then I've also said that you can reconcile, counterbalance that by the second phase of the day. So if QBank's the first phase of the day, the second phase of the day is doing, let's say, subject specific. You say, well, now I'm going to do Anki or Mehlman PDF cardio only this evening. And I'm going to do his cardio playlist, 10 questions on the YouTube this evening. And this week is my cardio week. So I'm going to spend this entire week reading his cardio PDF or doing the Mehlman Anki cardio only and doing only the cardio questions. You understand? That's your phase 2 of the day. But phase 1, when you're doing QBank, is always random mode. So you have a combination that way. Okay, that's how you can reconcile. Dahlia, what is the minimum number of PDF Mehlman pages should do every day. Bare minimum 10. 20 is like a good target. Nasser, did you see the lunar eclipse? I did not. I don't even know if that would be in Japan, right? Depends where you are. But I have the top floor of a building and it's high up, and I get some pretty awesome fucking moon sets and sunrises. Okay. Because I'm up through the night. Like it's 4 a.m. here where I am. So like I know the time of things. Like I know the moon sets at around 3:30 a.m. and it's like blood red. I posted a picture to my ex Twitter like 2 days ago. It literally looked like a fireball. If any of you saw that on my ex Twitter, I didn't modify it. That wasn't modified. It's like you have to say that. It's like, no, it's not fucking modified. It's like it literally looked like a fireball, huge fucking fireball. Picture doesn't do justice. That was like 3:30 a.m. suddenly because I go for a bike ride in the middle of the night sometimes. So I went for a bike ride, and then I was watching the moon set, and then at like 5:44 a.m. I watched the sunrise. That's like my peaceful moment for the day. That's my peaceful like 5:30 a.m. I just like no phone or anything. I just like watch the sunrise from outside on my balcony veranda, and it's like silent outside, super 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 calm. You just hear some like birds and stuff. It's like prehistoric, and it's like all like pink, and then the sun. There's mountains. There's mountains around me. Like I'm in the city, but there's mountains like an hour and a half bike ride away. So the sun comes up over mountains, and it's like it's crazy. It's like it's like religious. It's like religious, basically. Like if I'm agnostic, like that makes me like religious. Like the sun kind of coming up and like over the mountains and like kind of going from like very pink and like calm to all of a sudden like a blinding light in your eye. It's like, you know, and all the technology, because like I'm just like 18 hours a day of screen time. So it's like that's like the one moment of just like pure interacting with the real world environment, and like no screen, no fucking Instagram nonsense, or this like YouTube garbage, just like real life real life. Nasser, Daniel Bowman, what should I do while waiting to register for step 1? You finished UWorld, most NBMEs, Anki, PDS, CBSE. I'd want to know your timeline. Like when you said to register for step 1, when are you planning to sit step 1? That's our starting point. You have to decide when you want to sit step 1, and then that dictates our plan. We reverse engineer your plan based on when you want to sit step 1. Diraj Reddy, bro, I want to start my step 2 CK prep. Will you give any tips? ? Yeah, you'll do Mehlman QBank 2 CK, the 2450 plus questions. You'll finish that. You'll do singular pass of the CMS forms, 2 per day. You'll do NBME 6 through 8. You'll do double pass the CMS forms, right? And then you'll do free 120, then 9 through 15. Diraj. Marwan. Mehlman, I'm getting so close to finishing all of UWorld and your YouTube questions plus your PDFs, but even I forget the basics. What should I do, man? When is your exam? And I'd want to know I'd want to know scores, because let's say you're scoring really high, but you're saying you're forgetting, means you're not really forgetting. Okay, but if you're scoring low, then it means you're forgetting. Cube music. Appreciate it, Cube music. Nargis. I already said I'm not going to do NBME 32 on YouTube. Ahmad, amen. You just got over 70, free 120. Okay, exam in a couple days. You got 75 in the first block, 78 in the third block, somehow 57 in the second block. How do I avoid such a drop? You can't avoid that. That's how it works, okay? So you'll have some blocks that are high, some that are low, and that's just coincidental, because if you just rejumbled those questions as like a random mode, You take the same questions, you would have had like, let's say 60s on the blocks. Okay. So it's just, that's how it is. JJ Suarez, how effective do you consider the Mehlmanmedical for the steps? Very effective. And why do you emphasize not making your own Anki? I said it's a waste of time, the act of making your own cards and annotations, because you're not going to learn from actually writing it. You think, oh, I'm writing it down, I'm learning. No, you don't actually learn from that. You could learn by like reviewing, but if you're going to spend the time reviewing, I'd rather just have you do our Anki, which is superior to anything you would make. Or I'd rather have you do like more questions from our QBank. So the stuff you make from Anki that you think is important often is not important. That's the thing. So you say, well, it's custom to me. They're notes I want to review, right? But the things you think are important to review are not fucking important to review, and they're a waste of time. That's why. Okay? So you'll think something's important, and then it turns out it's not important. Or it's like super fucking easy, and it's like, why are you making a card on that? You don't need to make a card on that. You're wasting time. Okay? Shakespeare. Ayotunde. The crowns just mean they're the most active in the chat. I don't think so. I've said that already. I don't think so, Ayotunde, because there's been people I've never seen before in my entire life. Their names on the chat here who have crowns. So it's like, how are you like crowned as like most active in the chat when I've never seen you before in my entire life? Zaid. Moradon. You said there's a rise in strength when you spam questions of a singular topic. Would there be a theoretical rise strong enough in spamming QBank, Mehlman, QBank, NBME where you could rip step 2 and kill it? Random mode is still what I prescribe. You can do a high number of questions. Obviously, that's how we prepare for USMLE. Mehlman, QBank, CMS, double pass, all the NBMEs. It's all questions. Okay. So you're basically spamming questions for 4 months, and then you sit, yes, that's how it works. Todor, Todor. You're starting IM residency in Germany in November. Should you take step 2 before starting? The answer is yes. Or during vacation residency? No, because you're going to be very busy during residency and you're not going to want to deal with step 2 CK. Not at all. You're gonna focus on step 3 when you're in residency. And you're also going to want to like actually be a doctor. That's the thing, believe it or not. Believe it or not, you're going to want to focus on, like, you'll have a patient where you had to examine their shoulder or their ankle and you were like mediocre at it. You're like, fuck, I was better at this in like second year med. And then you're going to want to go home as an actual doctor and be like, you know what? I need to fucking like review how to do a shoulder examination, how to do an ankle examination. And like, you're reading how to do that. You're watching YouTube videos on it, kind of like self-embarrassed because you're a doctor and you should know how to do that, but you're like you have to study it. And instead you're like, no, let me go home and do my QBank, right? So you're going to want to actually like be a doctor and like learn important stuff clinically. And you're not going to want to deal with fucking like USMLE while you're in residency. So step 3 should be like the only thing you got to deal with in terms of like residency, step prep, not step 2. And you should have that knowledge base before going to residency. Like if you don't have a step 2 knowledge before residency, like what are you doing? So you got to get that over with before residency. The Beautiful Medicine. I don't, The Beautiful Medicine. I'd also ask you, like, are you familiar with Mehlman content? Like, at what point have you encountered Mehlman stuff to ask that question? The Beautiful Medicine. Like, are you new to Mehlman content? Have you ever seen one of my live streams? Have you ever seen my Instagram reels I've been putting out? Mustafa, can you give me a tip on how to lock in while studying? You can caffeinate, and you need to choose a time of day when you study best, and you need to just block out everything else. It's the phone that has to go away. The phone has to go very far away. That's how you can lock in. The biggest thing is just you guys grab the phone every 2 fucking seconds while you're studying. That's the problem. So the phone's got to go away. So if you're at like a library, I don't know, put the phone in your backpack, like under the desk, or leave it in your car, like leave it somewhere. Mike, you cut first aid on your last 2025 advice for step 1. When have I ever mentioned that as part of step prep? Even going back like to 2020, I never when I started giving advice in like 2021 on YouTube, like my old school clips that were getting like 5 views. I don't think I ever mentioned that. I was never like a first aid pansy. Like you get a lot of these like pansies, these cucks on YouTube with like, holding up their first aid. And it's like, you're living in like 2016. So I've never, I mean, what do you mean from 2025 advice? I've never pushed that. Right? I'm not a pansy. Nasser, even for IMG's research is not cool. Chat moved on me while I was reading your question, Nasser. Let me go find. Okay, even for IMG's research is not important for matching ? I've said it's overblown. If you're going to apply into radiology at Duke, then yes, have research. Okay, if you're going to apply into dermatology at Stanford, yes, have research. But for like everyone else, you don't need research. And even if you do, no one cares about your 34 bullshit papers that were embellished and you had an easy advisor who got you on second author for all these papers that you didn't do shit. People aren't disillusioned. They understand the game. So what would matter is if you had, let's say, one paper in Cell. Like they would look at journal. That's my suspicion. I'm speculating. They would look at journal. They would say, he has a paper in Cell, one paper in Cell. Holy shit, that's a big deal. Okay, but it doesn't really matter. They're going to look at your CK score. The CK is what's going to get you the interview. The CK, and then also maybe your class rank, not your grades, your class rank, because some schools can hand out honors like it's a candy store. It's like everyone get honors. Oh, you're all amazing. And then other schools, it's like nobody gets honors. It's like 4% get honors. And they're like, okay, the school wants everyone to do shitty. Okay, so it's not your grades, it's your class rank. Okay, when you're at a competitive place, and your CK score, and then your personal statement, they just want to see that you have some humility and that you're not talking about you and that you're a team player. You can be amazing, but it's not about you. It's not about you. It's about demonstrating that you're a team player and that you just want to help a team. It's not about you. Okay? They don't want that. Kyle Humphrey. Do you have any advice for the MCCQE Canadian exam? Yes. Basically just prep for it like it's step 1. Okay? We might make QBanks for that, actually. We might do that. But for the moment, USMLE. But you're just going to prep for it like it's step 1. Kyle. That's what you got to do. Okay, you're going to have some nuances, differences, things they do in Canada, but like pretty much like I would just do Mehlman QBank, honestly, step 1. Abdul Malik, what's a good score for non-US IMG for IM? Just pass. Just pass and then apply broadly. Okay? Apply very broadly. Arkansas. Oklahoma. Apply to like Tulsa, Oklahoma. Kentucky. Alabama. These would all be great places. It doesn't have to be fucking New York City, Boston, LA, Miami. If you're going to be in Miami, I mean, you got to be like fluent in Spanish and you got to be like, there'd be into the Caribbean students there. So not Miami, but you got to apply broadly. Barbara. What's a reasonable amount of time to study for step 2 after graduating 2 years ago? 4 months, Barbara. Abdullah, how long to study for step 1? 3 months. Diraj. Mehlman QBank for step 2 CK is enough to score 260 plus, double question mark. Please share your thoughts on it. Knowledge-wise, yes, but some people just aren't smart and they're not going to score 260 no matter what. But I was also saying, like, I don't even think you have to be too smart to get a 260 nowadays with score inflation. 260 was a good score when I was studying. Like, the average was a 232 when I sat back in 2014. Now the average is like a 250. So, but I think some people, no matter how much they study, they're not going to get high scores. And I've analogized it to, like, you know, you can get some neurotic parents and they're like, I'm going to get Michael Phelps as like the coach. Okay, I'm going to get Michael Phelps as the coach to get my son, daughter through swimming. But your son, daughter sucks athletically. They're not athletic. So it doesn't matter that Michael Phelps is your coach. Okay, so you can do like Mehlman QBank. You could do Mehlman Anki. Could even be meeting with me. But you have to have a certain level of capacity as well. Karam. Ethics, biostats. What do you do for that? We have an ethics PDF, ethics communication PDF. We've got a biostats PDF. We've got a biostats course, and also our QBanks are loaded with ethics and biostats. If you guys are doing Mehlman QBank, you'll know that there's tons of biostats, right? You notice that? There's a lot of biostats. We loaded it up. A lot of p-value questions too. Why do people complain about your QBank? It's basically the same price as UWorld. It's more expensive than UWorld. It's not the same price. I mean, it's better than UWorld. So, I mean, it's not really my concern. I don't really get pulled into the low IQ peasantry and complaints of people who are reaching. That's not really my concern. So it's more that we know our value, and you know, then it's up for people to decide whether they're going to go that route. And if they don't, we're not really concerned with that. So that's not something we really think about or care about. And if people are concerned about price, we don't want them anywhere near us. Stay away. Okay, because it means you're poor. Okay, if somebody's thinking about like the price of their phone bill, don't come anywhere near us. Because these are the people who complain and are a headache, and they're acrimonious, bitter, resentful people. So if it's expensive for you, stay the fuck away. Don't buy our QBank. Save us all a headache. Do your UWorld, do your Amboss, like go. You know, not everyone can afford a Ferrari. That's how it works in the world. Don't be resentful. Bomb Koth. Hey, Mike, I'm almost done core rotations. I was wondering if electives should be done before step 2. I mean, hit or miss. You're going to have your core rotations done before step 2. You said almost done. So you don't have to have electives done before step 2. Electives are usually 4th year, right? And that's when you get your letters. Champion, you're late today. Nargis. Victor, water. 4 days left in my step 3. Any last advice for me? Just make sure you're really set on the CCS cases. Just make sure you're comfortable with those. And just finish on NBME content. That's all you got to do. Victor, water. Mustafa, best schedule for dedicated period. Well, it depends how long your dedicated is. But it should be NBME focused mostly. High yield arrows for studying for step one. Make sure you know that. MGR asks, you got a 41% and made me 29. Also the same score and made me 28. Your step one was October 22nd. Now I don't know when to take it. Yeah, you're not anywhere close. I would say for you, earliest, you're not going to like this answer, MGR. I'd say the earliest for you, end of the year or January. 10% per month is good. Okay, so if you're talking 3 months, October, November, December, that means like December 8th. It's the 8th of September here in Japan already, 7th for you guys. You could go from like a 41 to a 71. That would be like really, really, really good. That's 3 months. So you could take it in December. Okay, but otherwise you're looking at like end of the year, January. That's good news. That's not bad news because you're not delusional now. You're like, oh, like, at least you were aware October wasn't, October 22nd even. It's too soon. Unless, is it possible to go through the USMLE if I'm living with cockroaches? Are you living with cockroaches? Are you? I mean, that wouldn't be a good situation. That's why you always want to live in, like, if you can, a very high up place and a new place. I'm on the top floor of a building and it's a new building. Victor. Cyan Tizer. You just finished your first read. How much time does my second read need? Second read of first and second read of what? PDS? AWS. Finished step one and step two. You were a great part of my journey and wanted to say thank you. Thank you, AWS. Ibrahim, is it hard to run a business with a time difference? No, because I'm better nocturnal anyway. I'm like naturally nocturnal. Balfan, do solid scores in step one NBMEs predict anything for your step two prep and scores? Yeah, of course. So, I mean, the best prediction of your step two score is your step one performance. Absolutely. Because like at least 60% of step two is just step one. Sujith, you just finished your step one. You're planning to also apply for residency in New Zealand. Any advice regarding applying New Zealand? I don't have advice regarding New Zealand. I lived in Australia for 7 years. Let me say. But they're similar to Australia in that it's very, very, very difficult as an outsider to get in. Even if you're a med student in that country, it's very hard to get placement as an international. New Zealand would be worse than Australia. It's tiny, and they have sensitivity to the Maori and like the way that Australia is with the Aboriginal communities. That's like interesting that you applied in New Zealand. You want to get away, huh? It's good when you're young. The idea of like getting away, like moving to a faraway place, like when I was in Australia for 7 years. Eventually, you'll understand like family more. And you'll be like, wow, I'm in New Zealand. I'm really far away. Ume, if applying for both IMFM, but you'll make your own family in New Zealand, presumably. But that'll be difficult because you'll have family in New Zealand and then you'll have family elsewhere. And then it's hard to generate the cohesion there. Ume, if applying for both IMFM, we should not apply to the same program for both specialties, Mike? ? I don't think it matters. They're not analyzing. The committees are separate. apply to the same place. If you're competitive, think about it. They would be like you'd probably have like intra school competition, right? If you're not, you're taking it from a defensive standpoint, as if you're like reaching and you're like, well, is it a bad idea? Would they reject me because I'm applying to both? It's like, if you're high value as an applicant, it shouldn't matter. You know, it'd be like the IM program wants you, but so does the FM program. They either would take you. Mac, how many plates do you eat per day? That's a good one. That's a good one, Mac. Zoma, were you the one in the Telegram group who just asked about Mehlman QBank and I kind of rudely shot down your comment? Zoma, is that you? 72.5, 72.5, 74, 73.5, 77, 74, 75, 77, 81, 79. Examine 15 days. Perfect. Don't need to worry. Scores are excellent. Very high. Mike, if applying broadly, should you select geographical preference or put preference on, or put no preference on application? If you're applying broadly, you would have to have non-entitlement and not have a preference. Be open to different locations, right? Obviously, you'll rank your preferred locations higher. Mariam. Thanks, Mariam. Marwan. Average score 40% overall. You booked your exam early December. That's why I want to take NBME's 25, 26, then review half what I studied, then take 27, 28, and then the remaining half in the NBMEs. Was there a question? Early December is too early for you. If you're scoring 40% on NBMEs right now, I think I said 3 months. It's still a reach. It's still a reach. I'd say by end of the year or January. Don't think of your time as wasted either. Like, for instance, if you're like, oh, well, I don't want to study for step 1 into January, think of it this way. All the study you're doing now is for step 2 at the same time without you realizing it. Because if you like shortchange yourself on the step 1 prep, what's going to happen is you'll just start like Mehlman 2CK QBank with a lower percentage. Versus if you study harder and better for step 1, then you'll just start with a higher percentage. So it's all overlap. John Shaves, thoughts on using step 3 questions for 2CK after step 2 QBank? Not necessary. I don't think you have to do that. It's not a waste of time, but it's not targeted. You've seen some IMGs do it. You don't have to do that. John Shaves. Because after you finish step 2 QBank, do the CMS forms twice. And 60, 15, if you're 120, that's more than enough. The CMS forms are a QBank. And you've also got the Mehlman YouTube, which is a QBank. Do the step 2 playlist. That's a QBank. Sujith, you're planning to do your pharmacology residency. You got an opportunity for this. Paraclinical course. You want to study step 2 and you get back home. What's your question? Any tips studying step 2? Yeah, I mean, this whole live stream, I'm getting tips on step 2. Sujith. Otako. Thank you from Algeria. Syed. When I do question bank, everyone says you're supposed to do it randomly, but I have a doubt I'm not done with all the systems yet. So should I do randomly or system-wise? Quadruple question mark. I said just go through random mode, QBank. That's my view. Sabika. Good to see you, Sabika. Thanks for being a member. Avantika. How to get into emergency medicine as an IMG. I'm not an expert on that. Okay, but I've heard there's like special requirements for emergency medicine. You have to have like certain experience level. It's particularly important your experience level for emergency medicine, like beyond scores. Like, did you work as a paramedic? Did you do like special training? That's what they care about for emergency. The Beautiful Medicine, what score CK for family medicine? Just pass. RTC, what's the best way to prep for rotations so you don't look low IQ? Just study for USMLE. If you do Mehlmanmedical, that's going to set you up the best. That's a very easy question right there. Very easy answer. Ibrahim, Al Hato. What causes score inflation? Is everyone just studying harder? I don't know, but this has been the case like forever. Like, okay, so for example, I'm saying that like when I studied in 2012, in 2014, 260 was a big deal. Now it's not. Now it's like 270 probably carries the same feeling. Well, it was the same. Like, there were people who took the exam. Like, when I was studying, there were people I knew who took the exam like many years earlier, where like if you got like 240s, it was a big deal. Like, the average used to be like 200. Like in the year 2000, the average was like 200. Like, it's not a joke. So I don't know what they do in terms of like, you could say, well, we have QBanks now and all that. I've just stated that possibility. But I think that maybe their scales have just shifted. Somehow their scales have shifted. Because the average is like 250 now. And there's people who are not smart who are getting like high scores. That never happened when I sat. Never. It was a big fucking deal to get like 260 plus when I sat. It was a big fucking deal. The same way you'd say, yeah, it's a big fucking deal to get a 270 plus, right? But now it's like, there's people like very dubious. It's like, how did you get a high score? It's like, you're not smart. Semi-pro plays, what's the highest score you've seen on Step 2 CK? I think like 280 plus. Dexalog. You have a physio exam, 7 days. What's the best study method to retain as much info as possible? Why you need like niche stuff for oral exams? Well, to retain as much as possible, people differ on that, right? Some people like Anki for really hammering information. What car do you drive? I don't need a car. I live in the city. And if I need transportation like that, I use, like when I travel in Japan, I use the bullet train. And I'll just have like my laptop open on the bullet train. I like public transportation. Because it gives me an opportunity to interact with people. I like meeting people when I'm transiting. So to like have my own car, I'd be like I could have cars. I just think that's like, I have no interest in that. I have no interest in that. I have a skateboard and I have a bicycle. And when I go to the gym, I ride my bicycle. It's like 10 minutes on bicycle. But no, like if I had a car here in the city, like I wouldn't want that. It would be something to worry about. Just be like, I have this stupid car sitting there and like, what do I do with it? Drive it once, like every 3 months out of the city to where? The mountains in my car, when I could just take a bullet train, or, like, what do I need that for? So, Hassan Kareem, I do QBank in morning, then evening, PDFs, Anki, YouTube videos toward the night. Is it good? I just started my second year as an IMG. We'll give third year, have around 6-7 months, I'll become eligible. Yeah, I've said that. QBank is your phase 1 of the day, 40-80 questions per day on time tutor random, and then the evening phase 2. Yes, PDFs, Anki, YouTube videos. Exactly. So you said that back well. Something close to that, you in Japan? Yes, I'm in Japan. I'm in Osaka, Japan. Why'd you go to Australia? I studied abroad in Australia when I was 20. I lived in Sydney. I worked at a hospital there for a couple months. I worked in an infectious disease area of the hospital, and I was doing research there. And Australia was awesome. And then that was sort of implanted in my mind of like, I'm going to go back to Australia. And then, yeah, it happened. I decided to go back. And that was the best decision ever for my 20s, being in Australia. That was the best decision ever. And you want to know the coolest thing about Australia is when you go into like the outback and stuff, like you see the sky. Like you see the sky. Like there's more white than there is dark. So Southside children, great work, Michael. Just curious, so there's no confusion. High-yield neuroanatomy is step 1, while high-yield neuro is step 2, right? Neuroanatomy is step 1. High-yield neuro is both step 1 and step 2. If you're studying for step 2 and 3, you can do high-yield regular neuro, yes. Furry X-DOP 80 on NBME 29, obviously very high. 76 NBME 30. Your score drop is panicking. It's not a score drop. It is normal. I've said that. If you just coincidentally Furry X-DOP sat 30 prior to 29, you would have seen yourself go up, not down, and you would have thought you improved. So it's coincidental. It'll be like that in the real deal as well. It's just, it's a luck, whether you get a form that happens to be slightly better, right? Guys, I'm gonna end this. It's been over an hour and it's like 4:40 a.m. where I'm like cracked out right now. Let me just scroll through. I answer like one more. Any advice for a nursing Lamepa? Any advice for a nursing student that has a dream of becoming a cardiologist one day? My question is, why would you want to become a cardiologist? Is it the prestige? Is it the cash? It's the prestige, isn't it? And I say that because like you get a lot of people where they start off first year in med school and they want to do cardiology or they want to do like neurosurgery. It's all these like, you know, prestige, the idea of prestige. And then like when you actually, the grass is greener. So when you go through medical education, you start to realize like things you like, things you don't like. I was originally interested in cardio. I was one of those people as well. I was like, I'm going to do cardiology, like when I walked in med school. And then I remember I hated cardiology. I hated studying cardio for step 1. That was like kind of the transition. It happened early for me. I hated doing cardio questions when I was studying for step 1. And I was like, man, I hate cardio. Like early on, I remember thinking that, you know, you got to ask yourself like why you want to do those things. Is it like your parents, you're trying to get parental approval? Most people are trying to get parental approval. You know, they're chasing a childhood dream of like something, you know, I'm going to be a neurosurgeon. I'll answer one more question. Would I get better experiences, Ajibola? Would I get better experiences micro rotations, New York City or Long Island area? I don't think it matters, Ajibola. I think it's a surprise. It'll be surprising that actually, if you go to a more rural area, you'll have possibly better interactions. Because and I say this because when I was doing family medicine in Australia, the way it worked, like they had an online portal where it like opened at like 5 a.m. or something. And like all the students had to log in and who were doing family medicine and select their placement. So you had people who were like waking up at like 4:50 a.m. to like waiting for the login to activate. And then they got in, they're like choosing center city because they didn't want to commute. So we're all like kind of living near the city, right? You know, in Brisbane, Australia. And we didn't want to commute. We're like, get me like a placement 10 minutes down the road. I didn't even like know of the fucking like 5 a.m. Login start. I wasn't like aware of it. And I was one of the last people to get a placement. And I ended up doing a placement out in like some rural area. I had to commute like 2.5 hours out there each way. It was like 5 hours of commuting. And I remember when I told someone, like a doctor, where I was going to be doing my family med rotation, he's like, you better like learn how to fight if you're going to be out there, because there's a lot of fucking like drunk people and druggies, and it had like a bad reputation area. And like, so I went to the rotation there. First of all, it wasn't like that at all. It was, but it was an amazing rural clinic. We just saw tons of patients with like different conditions, and they let me do so much. Like they let me do little surgical procedures and stuff, and we saw different ailments, people from the rural communities coming in. Whereas like I talked to my friends who were like in the city, who that's where they wanted to be originally, right? And they were like, it's so boring here. They're like, we just see like fat white people with diabetes. That's all we see. So they saw all the like the inner city fat white people with diabetes, that's all they saw. But I was seeing like some Aboriginals, like people from the bushland coming into the rural community with different issues. Okay, and it was just it was a good experience. So in relation to your question here, where you're saying like New York City or Long Island, it might not be what you think. You might say, oh, New York City, hands down. Not really. Like you might do like a placement in New York City, you just see a lot of the same, like it's just fat white people with diabetes and hypertension and like nothing else. And someone out in the rural area, maybe you see like a Warthin tumor or like something weird, you know? People who don't go to the doctor a lot. It's 4:43 a.m. where I am, guys.